I was going to take you through kind of two big questions and then like a third one on top. And the two main areas are how do we stop this current disease or try and how do we conquer it? And then secondly, how do we try and prevent future COVIDs? And then I wanted to ask you a bit about the sort of general effects you think this has had on society. But let's begin with this immediate one, which I know you've written about how do we conquer this disease now? And I know you've talked about 3 steps and things, but maybe you could take us through what you think a sort of realistic program on that is.
Well, the vaccines are very good news, and the supply constraints will be largely solved as we get out into the middle of next year. And so we'll be limited by the logistics and the demand. In a lot of countries, it's not clear what the demand level will be. Ironically, in a country like many in sub-Saharan Africa, where the epidemic hasn't been as visible, your demand for the vaccine, it's challenging to generate that, but we'll do the best we can on that. The other thing that's pretty impressive is that Merck and now Pfizer have oral antivirals that the Merck drug we've been able to reformulate to get it to be less than $8. And so we'll be able to have anyone whose age or medical condition makes them have significant risk immediately begin what's called presumptive treatment as soon as they test positive. So between natural immunity, vaccine immunity, and these oral treatments that can scale up in a way that the antibodies never did, the death rate and the severe disease rates ought to be coming down pretty dramatically. And, by next summer, getting to be, say, quite a bit lower than the average seasonal flu level is, assuming there's no surprise variants, which right now the evidence is that's not that likely, but it can never be ruled out.
What do you think, you just mentioned next summer, what do you think victory looks like in this? Is it effectively taking COVID back? You also mentioned the flu. Is it effectively making COVID a kind of flu-like disease? I know it is, but is that the kind of version of what victory is in your brain?
Yeah, things are fairly binary. I mean, if, death rates from driving were 10 times what they are, people might think, wow, shall we do it or not? Flu is accepted. The, average years of life lost for both flu and COVID is about 8 years because it's so prevalent in the elder versus the young. And we accept about a 60,000 average per year rate there. Now, I happen to think as part of the tools innovation to avoid the next pandemic, we ought to go and eradicate flu as well, because its mutations are another source of a significant source of future pandemic risk. But yes, the idea that economic activity will resume in full once you get to flu levels, it's very likely. Now, you'll have some hot spots where you'll still have to have non-pharmaceutical interventions or, huge incentives for people to get protected.
Just to push you a bit on the vaccination things, if you look at the way that countries are dealing with this, you have 2 very different ways of doing it. If you're going to take 2 extremes, you could argue there's the country which I live in, Britain, which tends to have opened up a lot, relied on vaccination, and is taking a slight, we'll see what happens attitude at one end. At the other end, you have China, which is really clamping down, but actually closing things down. Where do you, when you look at those, what do you see problems with both? Or which sort of basic strategy do you have more trust in?
Well, any country that was able to do what China did and stop it early before it exponentiated up, where you had case rates, above 2% of population, that's a huge blessing that they were able to do that. That means they have very little natural immunity, and so they have to drive their vaccination coverage up dramatically before they drop sort of that wall that's allowed them to exclude infection from coming in. But they'll end up the epidemic, with, 100th the deaths per capita of most of the rich countries, and you've got to see that as largely virtuous. Although,
but there is a difference there. There isn't. If you look at places like Singapore, New Zealand, Australia, they also have got a very good number. The Chinese numbers are amazingly good, impossibly good, some people might say. But even if they're fibbing a bit, they're still amazingly good. What's interesting, though, is that China has absolutely doubled down on this strategy. By contrast, we're in Singapore, Australia, New Zealand. They are opening up a bit. They're going in another direction. The Chinese strategy would seem to require keeping things locked down for perhaps another year.
Yeah, so the question of when you reopen up is you'll see different strategies on that. So what you try to do is drive your vaccination rate up and get a mix of the antibodies and the antivirals in stock and train your medical system so that's available so your death rate is down. In the face of Delta, maintaining that wall is very hard, and many countries will now decide that between their vaccination rate and the antivirals, the benefit of allowing people to flow in and out of the country, particularly against what it's like to maintain against Delta, that it's time to open up. But the death rate even of those countries will be, say, a 50th of what it's been in lots of Europe. The UK is kind of at the end of the spectrum, where this fall they kind of said, hey, let's act like it's flu, and they're paying somewhat of a price in deaths, but they are allowing people to do a lot of things. Even at COP26 at the receptions, they'd make you wear your mask on the street where your risk was very low, but once people are in receptions, they were taking their masks off.
That was that is hard to explain even to British people, and this government has explained a lot of things to us. If you look at, perhaps we can look a little bit, which I know you've also looked at, this issue of the longer term preparedness. If we have, we can argue whether China's doing the right thing or the wrong thing at the moment, but assume that what you say is right, and we push it back to flu-like levels. What, as a kind of world, do we need to do to prevent other epidemics coming along? Where do you see the main focus there?
Well, we need a few pieces. We need at the WHO level several thousand people who are experts in this and are totally dedicated to stopping infectious diseases and ready to go. And they'll do like germ games, like war games, where countries practice. And what those countries would try and be ready for is bringing up the diagnostic capacity even 10 times faster than, say, Australia did, which was one of the best, and then being able to implement the non-pharmaceutical interventions very quickly. Then we need better tools. If we'd had the vaccine even faster, if we'd had these oral antivirals, not now, but a year ago, and if we had a vaccine that was so powerful that it prevented breakthrough cases, which is now, those are a big part of these transmission chains. The science to do that, we should be able to conquer. So, literally for a few tens of billions, we'll build a set of tools within 8 to 10 years and a surveillance capacity at the global level, which will mean that for a pathogen like this, we'd pay, 1% of the price that we did this time.
Can I just push you on a couple of things on that? On vaccines, I'm intrigued. You've been involved in these for a long time. Did we get lucky with COVID with vaccines? Because a lot of people seem to think that the speed with which we developed a vaccine this time was lucky. It was obviously due to the skill of the people involved, but from a governmental, societal point of view, a lot of governments, Britain would be one very obvious example, were kind of bailed out by the unexpected speed of a vaccine. Do you think that's fair?
Yeah, we have 3 types of vaccines here. We have the mRNA, which the inventors are appropriately lauded for the work they did 10 years ago.
Yeah.
Organizations like US DARPA and our foundation were funding that, but none of those vaccines would work until the epidemic. So the fact that it didn't come, 5 years ago when mRNA would not have been ready, you could say that's luck. Then we had viral vector vaccines like the AstraZeneca or Johnson & Johnson. Those were invented about 8 years ago, actually partly through HIV and Ebola type efforts. And then finally, we had a class of vaccines like the Chinese inactivated, which we've been able to make those for decades and decades. And so if this had come 5 years ago, everybody would have probably made inactivated vaccines, which are not quite as good, but they work. And, those could have been made in scale. So yes, it helped that mRNA was there, but it wouldn't have been the end of the world not to have that. And next time, we're really going to have some good vaccines that, we'll understand the duration and we won't have breakthrough cases like with the measles vaccine.
When you said you talked about creating this, you invest a few tens of billions of dollars and you end up with a kind of vaccine preparedness. Is that money going to come from foundations like yourself, or do you think it's actually do you think this time governments will actually spend the money?
Well, if you can buy an insurance policy that, costs the actual global surveillance piece, the 2,000 to 3,000 people, that's only $1 billion a year. The bigger number is all that R&D work. Both of those have huge benefits even when you're not in a pandemic year. So I'm a little surprised we're not yet focused on this.
Yeah.
Because, the U.S. you'd expect normally to jump in with increased R&D. But, I think over the next year, if we keep reminding people that, this cost trillions and it killed millions, that this is going to be, the best insurance policy that anybody ever talked about, compared to defense budgets or, fire departments or earthquake preparations. This is very dramatically more effective.
You very eloquently put across the reason why governments should do this, but the question I asked you was, do you think they will, which is a slightly different one?
Yes, I think they will. I feel like they've been a little slow to come on to this, but the U.S. is often expected to lead on things like this, which we haven't done yet. But I'll
You'll chip in.
The voice of the foundation will be out there talking about what these priorities should be, and getting rid of things like the flu has huge benefits that that alone should be very exciting to people.
Even I would contribute towards doing that. On the underlying issue, you mentioned the word surveillance. One of this moves slightly into longer-term consequences. Do you think people are now much more willing to hand over data to let people look at things like health? You look at the origins of COVID. There was huge problems about where exactly it came, being able to work out all those sort of issues. And you've had endless anti-vax conspiracy theories and things like that. Do you think that on the whole, people have changed their minds about their willingness to hand over data when it comes to things like health?
Well, I'm not sure that, this was an interesting case test of people's trust in their politicians or their health system. And, statistically, we didn't do as well as I would have expected. In fact, I'm cited as some, mastermind of some evil plot in many, many cases. So, no, I didn't expect any of that. In some ways, the politicization of, taking vaccines and helping protect other people, you could almost say that's a step backwards. I hope vaccine acceptance for other diseases like measles is not reduced by this. But, a lot of people jumped in and took the vaccines, but a meaningful minority in most countries were led down a path of believing that not only, were there rare side effects, but that the vaccine wasn't properly tested or was part of some evil conspiracy.
It's interesting. I mean, even last night we talked to the Singaporean Prime Minister. You and I might disagree about lots of things to do with governments, but we would both vaguely put Singapore high up in the list of governments which have generally done a good job. But even here, you have 60,000 people who pretty much refuse to take 60,000 vulnerable people who have generally refused to take vaccines. Do you think that that is a problem globally?
I'm surprised they have that problem in Singapore. I thought they had a lash for people who pop bubble gum. So I'm kidding. Boy, getting big compliance is hard. My main experience of this before the pandemic was our work on polio, where we have to get about 85% of the kids to take the vaccine. And from time to time, we'll get rumors that make it very, very hard to achieve that. And then we'll get trusted leaders to set an example and give what are, in this case, oral drops to their kids. We've been able to succeed in that to the point where now wild polio is only in Pakistan and Afghanistan. So, if you stick with it and talk to the right people, you can succeed. In the case of this pandemic, we want people to get vaccinated rapidly so that we stop those transmission chains up to the elderly who, the U.S. still is at over 1,000 deaths a day.
The other problem to do with trust, very obviously to do with surveillance and preparedness, is between governments. And without going into the details, China had a slightly murky role in the origins of this virus. Do you think that people now are willing to trust government? Would you trust governments to reveal things about viruses in the future?
Yes. The sequence of this virus was made available at record speed.
Much quicker than SARS. I agree with that, but there were still people complaining about it before it became sort of publicly available, I think.
You'll never be perfect at the start. You can imagine an epidemic starting in, say, DRC or Somalia, and it would be even more difficult to get going as quickly as we did. So, I wouldn't assume that we're going to do much better in terms of a little bit of confusion at the start in the future. A lot of the risk of a future pandemic comes out of sub-Saharan Africa. So we need surveillance systems that can work even when the local government is dysfunctional or not interested in trumpeting the information.
I'll ask you one last question, which I hinted at the beginning. If you look at all the kind of consequences that people are talking about because of this disease, and in this case I'm looking wider than just healthcare, what do you think the biggest, out of the various changes that people think they've detected, which is the one which most intrigues you? Which is the one where you think there really is something happening in society because of what has happened in COVID?
Well, the breaking of the assumption that you have to go on lots of trips or you have to go into the office every day.
Well, you're proving it at the moment.
Yeah, and the rush to innovate in that software, which, we're just very much at the beginning of how, Teams or Zoom or various software products help you out with that remote presence. So, whether it's doctor's appointments or types of education or just, 5 days a week, I don't think we know yet how people are going to take advantage of that. But for the first time, people are thinking, wow, to some degree, this works, and the software is going to keep getting better in ways that I think will surprise people.
Just one very quick thing on that. Education, one last thing. Education, I know you've always been interested in that, and you've looked at this, the idea of digital education and people really embracing that. Do you think that is, a lot of people have talked about health as a consequence of this. Do you think that is a bigger long-term thing? I remember years ago talking to you about the Khan Academy and things like that. But that type of adoption of online methods, do you think that's finally going to happen?
Well, the quality of online curriculum keeps going up, and our foundation is very involved in that. It's our biggest bet for education is to have math curricula that's fun and interesting, and even if you fall behind and start to feel discouraged, that both the software and your peers and adults come in and help you keep that journey going. We need that. We need great improvements in the quality of education. What we've done so far mostly works for motivated students. So weirdly, the gap between the motivated student and the non-motivated student has actually arguably gotten bigger because the tools work so well for the motivated students. So the breakthrough that our foundation is now putting literally hundreds of millions into is how to use that interactivity and data in a way that you can motivate kids, have part of their self-image be, okay, this is valuable to me, it'll help me in my future. And so I'm an optimist about that, but it's still unproven how much digital curriculum can raise the average math education in any country.